What would you say, how are we going to build resilience so that when the next pandemic comes along, because this won't be our last one, we've taken the lessons that we've learned around that and used them for that?
Well, I think there are obvious places where, for example, we almost had just-in-time as religion when it comes to many countries when it came to protective equipment. That's easy to do something about, but it requires a little funding to get higher inventories of protection equipment. There is lots to be said about preparing for how to actually build medicines, how to do medicines in different countries and different continents, and be able to roll that out at scale quickly. And to do it quickly, it requires preparation to be able to do it. I would argue that good sanctionable trade agreements, such that we don't end up in immediately losing resources on a world scale just because one country does this or that, are the types of measures that we could take, longer term and more difficult, but it would build a greater resilience. We have a war call right now in many countries that says autonomy, and we should be very autonomous. All of that is good up to some level, but it creates an enormous complexity of duplication and cost if we are to do it at each country. So I would start with the first aspect of saying, let's try to make global agreements in such a way that they will actually hold even in a period of crisis. All of this, very interesting.
In a minute, Jay, how do we plan to mitigate risks like supply challenges, wars, and access in the future?
In a minute.
Yes.
So I think that early awareness and early thinking is absolutely critical. In the case of the industry, early planning for access, so that when you're designing a product, when you're thinking which products should be part of the research and development pipeline, already needs supply, needs to be taking account of supply issues, affordability issues, and how will a particular product be used in a primary or tertiary care system. I think at the end of it, you definitely need to see a closer collaboration between industry, public partners, and nonprofit organizations, getting the patient voice early on board, in order to make sure that the right products are being developed, the right access plannings are being there. And I think the last thing is, the efforts of an innovator, if done wrongly or if done rightly, may have a huge impact on the downstream inequity issues. So you end up putting more pressure on a health system that is already stressed if you don't think about how to relieve that stress up and early.
Thank you so much. I'm going to open up the floor for questions now, and I'd like to begin with Kezavino Aram. Please let us know also if you would like to ask a question. You can raise your hand and let us know if there's a specific speaker that you would like to direct the question to.
Thank you very much. It's very encouraging to hear all of you. I think two things, and then I'll come to the question. First is, I think the pandemic has shown us fundamentally, if health is not prioritized, everything can come to a stand down. So Chief Minister Reddy, it's so encouraging to hear you. To you, my question would be that strengthening of the primary healthcare system requires a lot of effort. We know of the doctor population ratio. We know that we don't have enough doctors, but the pandemic has also shown us imagining new partnership, the religious communities and their assets, for example. So that's the question to you. And the second question, of course, is to companies like AstraZeneca, which have made such a huge difference in the transfer of not only intellectual rights and products and vaccines. India is a beneficiary. India is also a contributor. Is how do we keep children as priority? I'm not asking our colleagues from UNICEF, but I'm asking you. I come from a country where 44% of the population are below 18. They have been the invisible face of the pandemic, to quote UNICEF. They will need 24 months, if not more, of investment to just come out of this crisis. How can we put, and to you as well, how can we put children back on the roadmap? They are not our priority at the moment. And you were speaking of resilience. One of the things that we say in public health, I head a Gandhian organization in India. We say it's mental health. When we speak of mental health and resilience, we say it's a connection between internal assets that a child has and external resources that a society provides. The pandemic really has shown us that that link has to be established. So to people who can make a difference for children from outside, UNICEF keeps advocating, but we have missed many opportunities to do that. And to you, Chief Minister Reddy, it's so wonderful to hear you speak about the healthcare system, but it will require persistence. Already this year, the central budget in India has a shrunken health budget. So how do we keep that going? Thank you.
Thank you.
The Minister start?
It was a very lengthy question. I put forth a lot of them. But as she rightly said, we have constraint on the funds. But yes, this is something that we need to deal with it. And in spite of our difficulties, we're pushing through with it. And we've allocated a 3-year window where we're wanting to mobilize $2 billion, 16,000 crores into this whole setup. And we're heading in the right direction, and we will do it. And as far as the doctors are concerned, as you've just spoken, we do understand that this is a predicament that we need to deal with it. And that's exactly why we're trying to open up more medical colleges. We're coming up, the state had 11 teaching colleges, medical colleges, till our regime had come in. Now we are actually opening up 16 medical colleges. So covering taking every parliament as a unit, so that there is uniformity in distribution. And a teaching hospital and a medical college together would provide for postgraduate students to come in and provide for the healthcare. So.
Thank you.
Let me add a perspective, I think, on primary healthcare. I've spent a lot of time in India, and I'm quite impressed with the way that India is beginning to use digital in a way to enhance primary healthcare, especially when you come out into rural areas, like in many countries. The ability to connect to someone who's an intelligent person, but also over time, artificial intelligence actually opens up tremendous amount of low-cost healthcare opportunities, which I think we should do much more of. On your question to children, I think the real world there is prevention. The real thing that we can do in healthcare systems, and possibly companies, my company is involved in some countries with this, is to enhance good lifestyle development, be able to make kids live a healthy life, but also to be part of that. That's very little cost. It's amazing, I think, that we have this 97.3, and the 3 here is for early detection and prevention among children. If we double that, that would be an enormous effort with children, and at very little cost compared to treating them when they have already become ill. So I think the real world there is prevention with children.
Well, if I can add a perspective there, I think